I've just received this flyer from the Merseyside Pensioners Association, Reclaim the NHS, and the Bath campaigns. It's pretty concerning. I'll read it out to you. It's quite straightforward. It calls for a stop to the Trojan Horse project, which is Physicians Associates. This is one part of a multi-pronged corporate attack on our NHS that's been kept quiet for far too long. So let's make lots of noise about it. The Royal College of Physicians has been complicit in the replacement of doctors with non-doctor physicians associates. It's a dangerous experiment with our lives, and there is no evidence base for it. Medicine is supposed to be based on science and evidence. To the Royal College of Physicians, we're a network of pensioners and NHS campaign groups from around the country, and we oppose the replacement of doctors with fake doctors. We demand reinstatement of Bevan's model of healthcare, nationalised, universally available, offering a comprehensive range of services, treatments and medicines publicly provided by appropriately trained, well-remunerated and well-regulated medical professionals, i.e. doctors, not non-doctors. Replacing doctors with non-doctors is dangerous for us as patients, dangerous for staff working with physicians associates and particularly for those supervising them, and is dangerous for physicians associates themselves. We oppose this race to the bottom, which is destroying what's left of publicly provided health and driving real doctors away from the NHS. To the government, you had no political or legal mandate to remove our access to the NHS services when and where we need them. To remove the Secretary of State's responsibility for ensuring excellent healthcare services are available to all of us, regardless of wealth, status, connections or postcode. You had no political or legal mandate to replace our NHS with multiple American models designed to deny us care and benefit big business. 10 million people at least are currently suffering and denied care on waiting lists. To the public and patients, when did you agree to be fobbed off with non-doctors and give up your right to see a family GP, to have local hospitals, A&Es, maternity departments closed down or outsourced to private providers? The answer is never. Patients have already been harmed and have died due to physician associates' negligence. Physician associates don't know what they don't know, so don't know when to ask for help. Physicians associates have been allowed to illegally prescribe drugs, order ionising x-rays and perform procedures that a doctor would have to have been qualified for years before performing. Physicians associates have been allowed to work as a GP upon completing their 2-year course, whereas a real doctor would have had to study medicine for at least 10 years to be a GP. To add insult to injury, physicians associates are paid much more than the many doctors despite their lack of qualifications, other than the 2-year postgraduate course, which does not compare to the years of study, examination and hands-on practical training trainee doctors undertake. Even if a physician's associate's scope is limited as per BMA suggestions, then physicians associates would effectively be working as healthcare assistants or nurses but paid more than them, leaving employers open to claim for equal pay. Such disputes and pay claims will cause further damage to trusts and services they can afford to provide. It's a very dangerous race to the bottom in terms of standards and good medical practice. This is no way to get waiting lists down. And they call for a lobby of the Royal College of Physicians, the NHS government and opposition, MPs, councillors and integrated care boards. And I think it's a pretty good initiative. And I'll leave it there. Thanks for listening. Bye.